very much. I think the first question from China was around land borders. Well, the land borders of the country are still closed, as you know, and that has been on for a couple of months. But at the sea entry, so what you see is anybody that is on the sea, even if you're coming from China, it takes you over 3 weeks. You know, if you're coming from Europe, it takes you almost 15 days. So in the timeline, it will have, the incident will have triggered itself because the gestation period is usually like 14 days. So it will have, that would have been, because it's a longer journey time. So the incident would have in itself showed up. But the land borders are still closed as we speak. Whilst the next question was if we're going to escalate prayers and people having contact with each other. I think that's the next question. Yes. Well, thank you very much. It's only when there are levels of escalation so that we also don't cause undue panic. It's only when we've realized that it is now getting person-to-person cases, right, in which we now realize, like we said, this isolated case from where it happened in this facility 3 days ago. He went to the hospital and it's been contained. Where he was staying was also an isolated guest house in that facility. So there had not been that much in terms of person to person. It's only when we see that or we notice that people have now, that we can now trigger the next level of isolation, and we'll be able to now say that, you know, events around public activity, people should curtail them or people should not. I don't think we've gone into that level yet, you know, and the commissioner can also speak to that. Why is it Lagos? The incident happened in Ogun State. Yes, Lagos is where you have the testing center. We have two testing centers, like we said. We have one with the Lagos State Health, and we also have at Luth. It's not every hospital and any hospital that can test this thing. Even worldwide, right? There are places where it can, and the reagents are also limited. This is a new virus, so it's not in any corner shop that we have it too. And also based on our own experience several years ago on the Ebola thing, you know, so we have a biosecurity activation mode that has been purpose-built, you know, and we can deal with incidents like this. We have prepared ourselves well enough, right? But my other colleagues in other states have also been passed, and the information has been passed on to them. But the other thing we also mentioned is that we're targeting international airports, cities that have international airport. So it's really Lagos, Abuja, Kano, Enugu, and possibly Port Harcourt that have international travelers. You know, that's where at the federal level they have actually put in place, you know, incidents where they can very quickly get information when it does happen. So what has happened between 10 p.m. you know and now, you know, how many, you know, that's late in it. I did mention when I was talking that the management of this facility, you know, up until 2-3 o'clock this morning, we're in contact with them, we're speaking, you know, and so they on themselves too have held down, you know, some or possible staff of their own health facility, and people have gone there this morning, right? It's a distance, right? And I can assure you that even as we speak, there will be information that they'll be passing on to us in the next couple of minutes and hours, as into what the status of those contact people at the facility in that company, what the status of those people are, and what are the information that is coming out from there. But I can assure you that at the highest level of that company, they are aware, you know, and they are giving us all the support and cooperation that is required to access anybody that we need to access.
So the idea is that we do not disrupt normal day-to-day activity. If there is no evidence that there is person-to-person transmission, then we just carry on with our surveillance and our monitoring and our containment. But if there is evidence that this virus is moving from people to people, then we will trigger the next level. For example, if we curtailed public gatherings, we would not be able to gather here today. So we don't want to disrupt our day-to-day life. We don't want to collapse our economy. You know, we're spending a huge amount of resources on making Lagos safe. And the whole idea is that we maintain normal activity from day to day, and everybody can go along with their business while we get on with the business of biosecurity.